And we can do that throughout America. Oh, and I'm going to throw a little wrench into the act here. Or into the car repairs, whatever they say. Pennsylvania, my fellow Pennsylvanians, we have an opportunity to become one of the first states that provides single-payer health care. There are bills in Harrisburg today. So I want you to get those phone numbers and call your representatives and your senators in Harrisburg today. Not tomorrow, not when you feel like it, today. And support the single-payer health care plan. Then I want you to call Senator Arlen Specter, Senator Bob Casey, Representative Mike Doyle. How about calling Jason Altmaier? You know, these people in the state and federal Congress, they work for you. But if you don't do anything, if you're too busy watching the Steeler game, too busy watching the Penguin game when it's on, too busy hanging out in the South Side, too busy on the internet, well, you know what? When your mom gets sick and you ask the question, why doesn't mom have her medicine? You know, she gets the blame. You! Guess who else she gets the blame? Herself. Get it done. Now we're going to take about a 20-second break because I need to do some technical work. When we come back, we will be speaking to the one and only Annette Bernice Mendel! Alright, you can tell we're shooting on location. You can barely see us, but we're doing what we can. But seeing our faces isn't what's important. Hearing our voices is important. But making the choices is critical. Now, Annette Bernice Mendel, you need to speak up loud. I got a question for you. Can you answer this question? In your life, have you ever, for any reason, had to take medication?
Yes.
And what do you think about the co-pays that Nancy Way and Martha Weiss pays?
I think they're terrible.
And what do you think about $40, $50, $60 co-pays?
I think that's ridiculous.
Why is that ridiculous?
Because it's additional money in addition to the medicine, how much that costs.
Now, I'm going to have to go to Kathy Payer over here to my right, your left. Kathy, why is it ridiculous? Come on over here so they can see your face here. Why is it ridiculous, Kathy? Speak loud so they can hear you.
It's ridiculous. It's ridiculous.
They can't hear you. They can't hear you!
It's not that it's ridiculous. It's not fair that you have to pay that much money for a prescription when you're supposed to have a good health plan.
Well, you know that there are people in personal care homes, nursing homes, and assisted living homes. They get an allowance of $85 a month.
That's not fair. That's not
Well, wait
right.
a minute. They get an allowance of $85 a month. So if they have a medicine that's $50,
There goes their money.
well, not only there goes their money, what if they don't have their money? They go without
They
their
go with that.
medicine?
No, I'm sure they get it, but
No, they don't. They don't.
it's not fair.
So, but
not
yeah,
fair.
but why should our fellow Americans care whether we live or die?
Because we're supposed to care if we live and die, because we're all God's children. We're supposed to care for each other. That's why he put his hair on this earth. To care.
Why should they care? Isn't that socialized medicine?
It might be socialized medicine, but it's there to help us survive in life.
So what do you want Congress to do?
Pass the bill.
What do you want the state legislature of Pennsylvania to do?
Let them pass it.
That's right, the single payer plan. So let's get some reality into the state legislature and the United States Congress. Pass the bill. What do we want?
Pass the bill.
When do we want it?
Now. Today.
When?
Today. Right
Today.
now.
So what do we want them to do?
Pass the bill.
When do we want it?
Today. Right now.
Today, that's right. And what do we need to do? Our citizens throughout Pittsburgh and Pennsylvania, what do they need to do?
They need
Make
to
phone calls.
contact-
Make those phone calls and go to www.senate.gov. That's www.senate.gov and www.house.gov. Now it's getting real dark. I don't even know if they can see my shining bald comb over or not. But aside the fun here, beside that, this is serious. Lives are being affected, lives are being lost because we don't have a health care plan in our country. Wake up. Every other industrialized nation on the planet has national coverage. Every single country other than the United States. That makes us look, on the global scene, makes us look very, very uncaring, makes us very deficient, and affects our economy. And by the way, it kills people. So let's get it passed in Congress. Let's go to that, www.senate.gov, www.house.gov, and sign some petitions at www.thepetitionsite.com. And for all of you out there, and everybody out here, September the 10th, 2009, on location in the West End, where there is a peace summit going on, and people are watching the Steelers game, which, by the way, it's the Steelers versus the Tennessee Titans, and hopefully the Steelers will win tonight. But let's be all on one team and make sure that we get health care in America. And while you're at it, remember that you and humanity really does matter. It's El Torcaso again. We're going to continue this episode. We started last night with Annette Mendel and Kathy Pear, along with Donna Weiss. We ran out of daylight, and the technical equipment I had wasn't quite up to par, so we had to stop. But we're going to continue this episode, and I now have a name for it. And I titled it, Humanity Matters, It's Reality. However, because of policies and what have you, I may retitle it once again, and it would be Torcaso Media Presents It's Reality. But ultimately, It's Reality will be part of the title. Now, I also spoke about a bill in the state legislature, in the state Senate of Pennsylvania, for single-payer health care. I did not have the bill number at the time, but for those of you watching, the bill number is Senate Bill 300. State Senator Jim Furlow introduced it. I would like all of you to support it, to call Jim Furlow and thank him for bringing it about, to call your state legislative bodies to tell them to support it and to vote in favor of it. I still at this time do not have the House version of the bill. I will work on that, and I may have it by the time this airs on TV. However, if I do not, it will be very easy for you to find out by contacting your state representatives. In fact, if you live in the Squirrel Hill, Greenfield area, or that area, your state representative would be Dan Frankel. So you can call his office. And then, of course, you can call wherever you are located in Pittsburgh. But this is a single payer proposal, and ultimately it would save us millions of dollars, and it would provide health care for millions of our Pennsylvanians. But let me throw it down slightly